Welcome back. Get this. A Cleveland Clinic survey finds men prefer to talk about sports, work, and politics. When it comes to their health, not so much.
Go figure. I spoke to two men about why it's important to get the conversation going, though. And in fact, they told me about the disease, that it's often misdiagnosed.
Well, HAE, or hereditary angioedema, is a very rare genetic condition that causes these random episodes of swelling. Any part of the body can be afflicted: the hands, the feet, the face, gastrointestinal tract, which can be very severe. Like I said, it's rare. It occurs in about 1 in 10,000 to 1 in 50,000 individuals across the world. And so one of the problems, there's this large burden of disease that we talk about, patients and delay in diagnosis, misdiagnosis, and we're out trying to get the awareness out about this condition, and so patients can get correctly diagnosed. There's an excellent website, discoverhae.com, that patients can go to, and it'll talk about the symptoms and testing and finding the right physician also.
And information is always something needed. But Alex, let's bring you into the conversation here, because you were recently diagnosed with HAE. How were you diagnosed?
Hereditary angioedema, HAE, comes to me through the maternal side of my family. More than 4 generations. My brother was diagnosed first and was able to relay the information on to me. So we went from struggling with this unknown disease for years to having a name and having some sense of what the challenge was. Because he shared that information, I was able to find a physician and a doctor who was able to help me and find a good course of treatment for hereditary angioedema.
And Alex, you said you suffered for something near 36 years before actually finding out, right?
Yes, ma'am.
And so, Dr. Manning, how do you actually diagnose this? How do you manage this disease?
Well, that's one of the difficulties in HAE, is actually getting the correct diagnosis. There's a long delay. Patients on average, it takes 10 to 11 years to get the right diagnosis. Most patients start having symptoms before the age of 20, and so they start seeing these episodes of swelling or abdominal pain that are not responding to typical medications. So seeking the right physician, there's a simple blood test that you can do that diagnoses hereditary angioedema, and once you've got that diagnosis, you confirm the diagnosis, get with an HAE expert, then you can get on the right treatment path to really reduce the burden of this disease and live as fairly normal life as you can.
And how do you manage that, though, to lead a somewhat normal life? I don't know, Alex or Dr. Manning, you could probably answer that as well.
Obviously, communicating with your doctor, finding a course of treatment that works for you. Every patient is different. Every individual responds differently, not only to medications, but the types of symptoms and triggers that you have with hereditary angioedema. It's very elusive, and so it presents itself in many ways. Often with HAE, it gets misdiagnosed. So it's a day-to-day struggle. For some people, it's easily treatable, and for others, it is debilitating and can be an everyday challenge and life-threatening. So it varies from individual to individual.
Well, Dr. Manning, Alex, thank you both so much for raising awareness to the issue of HAE. Thanks for being with us.
Thank you.
Thank you.
And we'd like to thank Shire for sponsoring this segment.